you are clicking on this video, I'm sure you want to know how you'll be able to pass your adaptation in less than 8 weeks or in 8 weeks period if you are being offered the adaptation route. There are many questions on your mind. Will I be able to do this? Is there anyone who have successfully done this? What is expected of me? What am I expected to see? Is there any person that has failed it? Has somebody else successfully passed through it? I, for example, am one of those people who have successfully finished the adaptation here in Ireland, and through this route register with the Nursing and Midwifery Board of Ireland in Ireland. I was able to do this in 8 weeks period. Many of my friends have also done the same thing. So I think I am the right person to tell you this news, the pros, the cons, what is expected and how it goes. If that's the kind of questions in your mind, then you're on the right channel. Make sure to click the subscribe button. Turn on the notification bell so that whenever I post videos like this, you'll be the first to know. Have you done that? Then let's continue. My name is Ndoweso. I was offered the adaptation route. And what is adaptation? Nursing adaptation in Ireland is you coming into here to practice during a period of supervised placement you are going to be supervised by a registered nurse for them to assess if you have the necessary skills and the necessary knowledge to be able to be registered as a nurse in Ireland. This is for a period of minimum 6 weeks and maximum 12 weeks. Unlike the OSCE RCSI exams, there is no repeat for adaptation. There is only a extension. So like I said, minimum of 6 weeks. So if after 6 weeks they still cannot find you eligible, then they can give you a period of 2 weeks to continue, another 2 weeks, another week, another week, another week, till maximum of 12 weeks. So if after 12 weeks you still have not been able to prove yourself worthy to be a registered nurse in Ireland, then they will send an eligibility report telling NMBI that you are not eligible as per their observation and you will not be registered as a nurse. You need to go back to your home country and start all over again. Recently, there have been like a new reforms from the NMBI. So you now have, every hospital now has to do like a 2 weeks of theoretical placement. So what this means is in the first 2 weeks, you're going to be undergoing more like lectures, class teaching, them reminding you of many things that has to do with the hospital, that has to do with nursing. So you'll be taught things like the legal frameworks and consent, the hospital policies, the salary department will come in and talk about your salary, talk about how you sign in or clock in, clock out. You will be given orientation of the hospital environment, introduction to many of the staffs like the HR, the director of nursing, assistant director of nursing. So in your ward, you'll be shown to your clinical nurse manager, you'll be shown to other staffs, the consultants, just to, make you get acquainted with the entire facility. You'll be taught about how the admission process in the hospital is being done. So even though it is general, they will also still try to be specific to your area. For example, if they are teaching something like vital signs, the I-News, they're going to teach you the theoretical part of it. And then they will tell you, okay, in your ward, if this happened, this is what is going to happen. If they teach you something like false, and then they say, okay, in your unit, this is how it is done. So everybody is carried along during these 2 weeks. Trust me, you have to really take these 2 weeks seriously. Within these 2 weeks, 1 or 2 days within the 2 weeks, you'll be taken to your unit, you'll be introduced to your line manager, you'll be introduced to other staffs, the consultants, the healthcare assistants working in your unit, the admin staffs, the consultant secretaries, depending on the complexity of your hospital, just for them to get to know you. When you start to know you are now part of the staff members. And after the 2 weeks, so that 2 weeks is counted as week 0. The first week is your week 1 when you resume officially to your different unit. So you resume to your different units, and then you'll still be introduced again. They'll give you one person now specifically that takes you around your unit, introduce you to staff that were not there maybe the first day that you came. And then during this period, so you need to learn the names of your consultant, the names of your assistant director of nursing, the name of your supervisor, your preceptor. So depending on where you are, if you are in the ward, you'll be given a preceptor or giving somebody to work with, another staff nurse. So basically that week is mostly your like observation week. So you're observing whatever is going through. They may not allow you to touch anything. Also remember that during adaptation, you are not allowed to do many things, even though you had been doing them. Let's take, for instance, you have been administering medication as a nurse, of course, but during your adaptation, you cannot do that unsupervised. You have, because somebody is constantly signing off of anything that you're doing. So the first week is like the orientation week. Is also the week where you do your first initial meeting. So the initial meeting is them. There is a book called the logbook. There is a manual from NMBI where you sit down with your preceptor and then your line manager and yourself. You set objectives of what you're going to achieve within the next 2 weeks. So you set objective. I'm going to learn the name of this. I'm going to start to learn. So this depends on your unit. So there are things that your line manager always draws out, like how the entire adaptation period is going to look like. What is expected of you to learn each week during your adaptation. So that will be put into your objective, and then if there is any question, you ask. If you need any extra help, you let them know, and then they will leave you. Every day you go, you might have different preceptor depending on your unit. I had like different preceptors every day because of my unit, but some of us did not have that. Some of us had like one preceptor because the same person is coming to work and you're trying to work in the same unit, so they just give you like, this is your preceptor that is going to be with you all through. Some will have like 2 all through. So after each week on Friday, you go meet your preceptor with your logbook. Every day that you go to work, you write down what you've learned, write down what you've done, based off of the objective that you set initially at the beginning of the week. So your preceptor will go through it and with other people, experience with you, and then say if you have achieved that objective. If you have achieved, if there's anything you need to improve on, your preceptor will write it down. Okay, Nduweso was able to do this. She needs to learn this. She needs to learn this. She needs to learn this. You've taken note of what they have congratulated you on. You've taken note of what they have said you need to improve on. And also the way I used to say something, before somebody will even tell you that you need to improve on this thing, personally, I know something I do well. I know if I do something not so well, I know. If I did not do well at all, I know. So I believe everybody should be able to assess themselves honestly. Do not look at the fact that people will say, this one is the R word, RACISM word. If you do something well, you know you did well. Honestly, not you just saying it because you want to make some other person feel bad that the person is not liking you. No. If you're honest to yourself, when you do something right, you know. And here in this country, when you do anything, when you are not sure, ask questions. It's better you ask than for you to go and make mistakes. They prefer you ask questions because it just shows that you're ready to learn, you're ready to improve yourself and all of that stuff. Then that's your first week gone. The next week, you also set a new objective with your line manager and your preceptor. And then you continue the rest of the week. So in the next week, you might, if it was like an inpatient unit, you might be given one patient to work with. Even though you are giving one patient, you're still working under somebody's supervision. So your patient is time for medication. Let them, it's time for this, my patient to take medication. The person will say, okay, let's go. You go and set your tray, go and give medication. Like in some of us that don't have to do that kind of medication, Anything we need to do, you just tell your preceptor, oh, your preceptor is going to pass catheter. Can I do it? Can I try it? Preceptor is going to do this one. Can I? Because if you don't say it, they will not. Most of them will not ask you. We are different when we are teaching somebody. Someone like me, I remember when I was still back home. If I have student nurses coming in, sometimes I don't wait for them to ask questions. But there are some people that want it because they don't want it to feel like. I remember when I asked my preceptor, why is it that you're not asking me to do something? She said, I don't want you to feel like I'm pressurizing you. If you feel comfortable enough, let me know. So from there, I just took my lesson. I said, no. So if you feel that you can try something, let them know that you want to try it. But some of them will not ask you to try it. It's not like they don't want to ask you, but they feel like if they ask you, it might come off like they are trying to force you, they're putting too much pressure on you. They will always allow you to learn at your own pace because we all learn differently. So your week 2, you'll be given like one patient to manage, not entirely, but to manage. And then in your week 2, if it's an inpatient, you could be given that same one patient, but now you are on your own. They wait for you to make the decisions for that patient in some certain areas. They are still supervising you, remember. So you can't do anything without letting them know. Because if you are giving medication, yeah, they need to. Of course, an adaptation nurse is not even giving medication. You can't even go and say, I've given paracetamol, and then go and tell your preceptor, I gave paracetamol. No, it doesn't work that way. You need to tell your preceptor, it's time for my patient to take paracetamol. They will come with you together immediately, and then you give. So because they are responsible for that patient, they have their license, you don't have. So if anything should happen, it's like when you are a student nurse, you are not going to be blamed for any mistake, but the registered nurses. So that's what adaptation nursing looks like. So in the third week, within the third and your fourth week, you will have your second meeting. So your preceptor will come in again, your line manager and you. They will go through what you've done previously, if there are areas to improve, and then look at what they expect you to do in the next week. And then from your second meeting, which is called the intermediate meeting, from your intermediate meeting, it's already clear if you would be like signed off in 6 weeks, because if you are making progress, they know. You yourself, you should know as well. If you are making progress, they know. So within 4-5 weeks, they will do this intermediate meeting, and then you continue. You work and you go to work make sure you go to work on time. Make sure you close. If you are sick, please let them know. You don't just say you are sick, stay at home, because your attendance is monitored, is part of the things that are taking you for your neatness, your ability to communicate, the ability to be friends with people, how you speak with patients, how you relate with other staff. All those things are also big, because nobody wants a member of staff that will come in and then it's just there, and then because of you, the entire unit will now look somehow. No, you need to already integrate yourself into the system, because even though you are yet a registered nurse, you are still part of the team, sort of. Okay, so you're in the intermediate meeting. They might even tell you, oh, okay, the way we are seeing, we may want to we will likely extend you with in 1 week, in 2 weeks. Personally, it was during my intermediate meeting, I already know, because I think my intermediate meeting I happened in my 5th week. I already knew that I need time, because there were some things I needed to learn. I didn't have the opportunity to learn them, and I did not want a situation. My manager kept saying, I don't want a situation where you are signed off and then you still have to be learning these things. We have to come and start retraining you. No, we want a situation that when you are off, you can solely be on your own. And I also want that for myself. So I was even the one suggesting to someone, I wish I would be extended with 1 week. I really wish. And then why will you say something? I said, because I want to know this particular thing, because it's part of the things we should be doing, but I don't know yet, because it was many things were very strange to me. The machines that we used is very different. I've not used any of them before. Many of them I've not even read about them before. It's just new. But luckily for me, I'm a very fast learner. I like to pride myself as a fast learner because I am. So if you are not a fast learner, give yourself time. Don't put yourself under unnecessary pressure. Try to speak out what is in your mind. Don't sit down and think that somebody will understand you. No, it's only you that understand yourself. So it's you that should make the next person understand what you're going through. If there's as adding 2 3 patients for you, you can, there's no problem in telling your line manager, is it, can you reduce it? I just want to get to learn it first. Then, because I remember back then, one of the complaints I used to have is that I am not fast enough. Then I will say, it's not like I can't be fast, but I need to know what I'm doing first. By the time I'm sure of what I'm doing first, speed will not be my problem. And truly, I can say that today, speed is not my problem anymore. It's not. Because I know what I'm doing. It's like when you are going somewhere, you know the road you are going. You can even close your eyes and be running. But if you don't know where you're going, you are looking, especially if you are driving, you are looking and make sure that you don't miss the turn. So it's the same thing. And also, some hospitals do not even sign off in less than 12 weeks. They want you to completely finish the 12 weeks. And you know, if you are employed in these hospitals, you also need to, because even if you're making mistakes and they need to sign, say you did not pass in 12 weeks time, your visa is almost gone, then even if you want to like start again to, you know, apply and still stay in it will be very stressful for you. You somehow become illegal in the country. So you need to be involved in your own process to know exactly where you are. Okay. And then after this second meeting, the next one will be the last meeting. So after your second meeting, by this time you are like 80% ready, because from your 5th 6th week you are 80% ready. So they could give you some form of independence in patient care. What I mean by that is, if you are in the ward, they could allow you, not coming to be telling you, your patient in room 2, you've not given medication. Your patient in room 1 is calling for you. Your patient in room 2, it's time to go and see, the go and do their scan. No, they may not be doing that again, because they know you are taking charge now. You will be the one to tell them, my patient in room 1, it's time for them to go for their scan. I need help. I want to call this. I want to do this. I just tell, let me let you know. That's how you should be doing at that time. Okay. So if it's like a place like us that you're doing a scan for a patient, so they will just be there looking at you. They won't say do this, except they say you struggle and you struggle. It's okay, this is what you should do. So they are now like supervising, not actively teaching you, if you get what that means. So, and then at the end of the time, if they will come for the third meeting, if you are able to do everything that is set out in the word that a nurse working in your unit should be doing, then they will sign you off. Otherwise, if there is a limit that is okay, even if you can't do everything, as long as you can do this, you can learn the other ones while you are on the process, because there is time for probation. Okay, remember, your adaptation period is also like a part of your probation as well. So they can sign you off, or they can decide, okay, they want to give you 2 more weeks to complete it. Okay, so make sure you speak out. Most times, one of the things I learned from adaptation is the ability to speak out. And I want to be completely honest in this speaking out of a thing. If you come from a background that some of us comes from or came from, that if you're speaking out on a particular thing, that thing becomes a problem to you. You have that, I don't want to call it trauma, but you just have that consciousness that this is what I want to say, but I can't say it. I can't say it. I remember my manager was always telling me, you don't want to talk. How do you expect us to know? But my fear is, if I tell them this, because I've had that experience that I tell somebody that is my manager or my in charge, this is what is happening, this is what is happening. And before you know, the next day, they will be, in 2 months time, they are mentioning that thing you said. So it becomes a problem for me to be able to speak out. And I also hear some other people say these things. It's not like I wanted to say it, but I did not. It was when this person called me to a room and was trying to really know what was wrong with me. It was when I now say that this was my, she was like, why didn't you say it? I've had somebody tell me that, and by the time they now know what was they were now able to guide her through, and she finished adaptation successfully. So this is one of the things that make people fail, because another thing that could make you fail is your health challenges. If you're not healthy enough to go to work, especially if you're in the ward that you're doing a 12-hour shift, and then you go to work today, by the time you finish taking care of patient and then you go home, your knees are paining you, your head is aching, your body is weak, and then the next day, by the time you're supposed to wake up by 4 or by 5, depending on the distance between you and your facility, you are not able to wake up by that time. You are now going to work 30 minutes late. What do you think the person supervising you will say? They're not going to be happy. That alone is already setting them into an angry mood for the day. And then if you now make any little mistake, it becomes aggravated. I hope you understand what I mean. So your health also matters. Some people may have challenges, or some people have challenges because of this. You could also have challenges because of accents. Accents. I've heard people say, I cannot understand what they are saying. They are talking to me. I cannot understand. A patient is pressing the call bell and you answer the call bell, and the patient is talking and then you cannot understand. Which is why I always recommend, if you are planning to relocate to countries like this one, especially this one, even in UK, this one that have different kinds of accents and they are not pronouncing their words one. Please stop watching movies online. Start watching international movies, international TV stations, international movies on Netflix, on YouTube. Start watching overseas YouTube content creators so that you listen to the accents. Somebody like me, if I want to put myself in the accent kind of it, I would say that the only challenge I have with accents is less than 5%. And I don't call it the accent, I call it just the way people speak. For instance, even back home, it's our dialect, right? We are all from the same Akwa Ibom. But there's a particular Hanang person. For example, if he sees somebody from Ikore Ikbene speaking, it could be very hard to understand because they call things differently. That is the kind of thing you should be having, which means that if you now live here for like 2, 3, 4 weeks, 5 weeks, 1 month, 2 months, you should be able to hear everything. But by the time you did not even listen to the accent and you were busy listening to your dialect alone and some Ona or Pidgin English only, it would be a struggle. It would be a struggle for you to understand them. So start watching international movies with different accents, please. And I think those are the tips I have for adaptation, which is what I personally applied, and I was successful in 8 weeks. In fact, that 8 weeks is I don't even know, it sounds weird when I say 8 because it's actually 7. It's actually 7, not 8, because one of the 8 weeks was the week that we were off. The place was closed, so it was Christmas break. There was nothing happening. Okay, so it's actually 7 weeks that I finished my adaptation. So if you have any more specific questions about adaptation, or something you've heard people say this was what made them fail, let me know. I will let you know if it is true or not. Let me know in the comments, and make sure you subscribe to this channel. Turn on your post notification bell for all of my videos so you don't miss any of my videos. I also do content about study abroad. If you want, I can guide you on how to apply for schools for admission, on how you can get admission internationally, prepare and submit your document for visas, and all of that stuff. So you are on the right channel, and thank you. See you next time.